So hello, I'm Dr. Julie Platt and I've been here for 4.5 years.
I'm Dr. Antonio Villarivera Jr. I come from the Philippines. I'm currently an associate professor here in UMed, and I've been teaching for 7 years, mostly for years 3, 4, and 5. Most of the time, we incorporate a case-based type of discussion to our lectures as well as simulation scenarios for the students. We feel that this will help them become more competent and safe, especially when they go into the clinical years.
In terms of recognising students that are struggling, so it could be areas where they're not performing as well in their exams as might be expected. There might be absenteeism, or you might notice that a student's perhaps a bit distracted in class and not as engaged as they normally are. So if we have concerns about a student, we'd organise to meet with the student and just informally say, I've noticed that you're perhaps not as engaged in class as you might be. And then you'd want to hear from the student what the difficulties were, whether they were in difficulties at home or with university. So at Newcastle we have academic mentors for each of our students. So each student has an academic mentor each year who will meet with the student around four times during that year and more if required. So we might signpost the student to the academic mentor who would provide them with some support. If they felt that they needed more support, then we could signpost them to the student support team who can provide additional support if they have difficulties with language or they need some study advice, or if they've got more complex pastoral issues, and the student support team can help them with that.
As a medical student, we need to incorporate as much knowledge as possible, and not only knowledge but also competency, so that when they go on to become doctors, they would not only know the reason behind doing it, but also have the confidence and resilience in terms of managing cases. Upon graduation, we are pretty confident that our students are able to tackle the hardships and rigors of clinical life. So they are not only able to competently manage patients, but we feel that communication is also very important, not only when communicating with patients, but also other allied professionals as well.